Major depression, a condition suffered by 5% of adults worldwide, yet widely misunderstood by the general population. When people hear the word depression, they think of sadness, or that the person just needs to buck up or pull themselves together. But depression is a serious illness that goes much deeper. It isn't just a lack of positive thinking. It can lead to serious health complications and negatively impact all aspects of a person's life.
Depression, like all mental illnesses, are just that, illnesses. It's very easy to consider something as being physical illnesses and other mental, but actually what we find is that everything has a biological basis. Yes, the symptoms are to do with how we think, how we feel, our emotions, how we react, but the causes are biological.
The guilt is a big problem. You always feel like you should be able to do something to get rid of it. You should be able to do something to get on with things. And with society constantly telling you that you can do anything that you set your mind to, I don't think it's any great wonder that those of us with problems setting our minds on things, we feel that it's our fault. And I think that is one of the worst things about depression, that you can't get over that feeling of guilt, that it's your fault. Even though there's nothing that you can actually do about it, you can't stop feeling guilty about it.
That's a difficult question. There is no one single cause. It is a very complicated set of biological conditions, probably several completely different biological conditions that all look similar. Therefore, for convenience, we group them together as depression. In terms of what increased someone's risk of depression, there are lots of different things. Genetics is definitely one of them. If you have an identical twin with depression, your chance of having depression is something like 30–35%, much more than you'd expect in the general population. If you have a non-identical twin with depression, though, your risk is much lower, maybe somewhere around 15%. Genetics is therefore important, it has an effect, but it's not everything. Even if close relatives have depression, it doesn't necessarily follow that you will have it as well. There's also lots of environmental things that have an effect. Suffering trauma in childhood definitely puts someone at risk of depression. Extreme stress in adulthood, whether it is sustained stress or particular traumatic events, again, increases risk. Again, it's not everything. You might have two people undergo the same thing. One develops depression, one doesn't. It's not clear cut. But these things all seem to kind of add up the risk you have.
People who have suffered from temporary depressions or depressive episodes or whatever, they'll say to me, oh, but it's possible to get rid of depression. You can make yourself better if you just do this, this, and this. And I'm thinking, what, should I change my DNA then? Because chronic mental health issues are genetic. I was born with depression, so was my mother and her father. It's not just going to go away. And yeah, okay, there are things I can do to help to stave off depressive episodes, but it's never going to completely go away. There is no cure. And it's just a case of managing it and trying to make life work, knowing that I could have a bout of depression at any moment. It's that day-to-day fight that people who have suffered from temporary mental illnesses, they don't understand that.
In terms of its biology, we know that a lot of depression comes down to how our neurons, our nerve cells, communicate with each other. We know this because most of the drugs we have affect this. We have drugs that affect the amount of serotonin that is available for transporting signals between one neuron and another. They work in at least some patients. Therefore, it is clear that serotonin transport is an aspect of depression. However, not all drugs work on all people. One drug might be useful for one person, one might be useful for another. And what this suggests is that there's a variety of different biological things going on inside us, some of which cause depression in one group, some of which cause depression in another group. And a major aim of research is trying to identify these groups. So we can say not just that this person has depression and this person also has depression, but this one has depression caused by this biological effect. This has depression caused by a different biological effect. And hopefully this will provide information to help us get the right treatment for the right patient as soon as possible.
In 2004, the World Health Organization described depression as the #1 cause of loss of years due to disability.
Despite being a leading cause of disability among adults, depression and other mental illnesses are still stigmatized by the general population. This stigma has 3 main forms.
Self-stigma is how a depressed person views themselves in comparison to their interpretation of society's expectations. It can make them less likely to ask for help and adds to guilt and ultimately increases the symptoms of depression.
Public stigma is how depressed people are viewed by society.
A 2018 study in Japan found that 30% of people thought that depression arises from personal weakness. It leads to labeling, stereotyping, and an us versus them attitude, seeing depressed people as somehow other.
The third kind of stigma is institutional, which occurs within companies, organizations, or governments. It can affect how likely a government is to spend money on mental health research or interventional strategies, or how likely a depressed person is to get or keep a job. The common effects here are loss of status and discrimination.
But there are steps that we can take to fight this stigma, and things are slowly improving. But there is a long way to go.
I think the worst one is, why don't you just pull yourself together and get on with it? Or leave your personal problems at home, don't bring them to work. Things like that. And people thinking that you're just being lazy. It's really difficult to explain that you can't leave depression at home. You can't just pull yourself together. It's not that simple.
It's certainly true that our opinions on mental illness have changed over time. This isn't because the illnesses themselves have changed, it's more to do with how we as a society have come to understand them. Things that decades ago might have been seen as just personality quirks or even, and I don't like to use the word, but weaknesses, are now understood to be real biological effects and harmful, and ultimately just a type of illness. We'll take something like homosexuality. In former decades, this was considered to be a mental illness because it was seen as different from how other people were. However, these days we would say that is not the case. Nothing has changed. The biology behind it is still the same as it was, but perception has changed because we no longer see it as being something that is a problem.
People will say to me, oh, you need to get more fresh air and exercise. And sometimes I feel like screaming at them, do you think I have suffered from depression for 20 years without knowing the benefits of exercise? It's just that it's one of the hardest things to do when you're depressed is to exercise. You just can't, you don't have the energy, you can't persuade yourself to, you really, really don't feel like exercising, even though it's one of the best things to do. And the trouble is that in saying to me, oh, you need to exercise more, what they're actually doing is reminding me that I'm not sticking to my own rules. They're bringing back the guilt that I feel that I'm depressed. And it's actually the opposite of helpful. I know they're trying to be helpful, but it's really, all it does is to re-emphasize that I'm not managing to stick to my rules, I'm not managing to stay healthy, and it makes me feel even more that it's my fault that I'm depressed. what sometimes is helpful is when someone says what they did with their depression. That, when I had my last depression bout, I found yoga really helpful. And, it sounds the same sort of thing, but the emphasis is really, really different. The emphasis is on empathizing, not criticizing. And it makes a huge difference to know that somebody else understands what you're going through, understands the difficulties, and is trying to make helpful suggestions, but with a very, very different emphasis. They're not criticizing you for not exercising, they're telling you what they found helpful. And that is a subtle but very important difference.
The brain is like a sorting office. Normally, our thoughts are organized and well regulated, and we know what thoughts belong where.
In depression, this sorting office goes into slow motion. We cannot organize our minds properly, and making decisions becomes a lot more difficult. This puts our mind into default.
Every decision we make becomes more difficult, right from when to get out of bed. The default here is not to get up at all. Then what to eat is another difficult decision. The default is not to eat anything. What to take with you when you leave the house also relies on this faulty decision-making process. This leads to the forgetfulness so often seen in depressed people. It also affects our interaction with other people. Is the person we meet a friend? Should we talk to them? This leads to the social anxiety and withdrawn nature in depression. Another important factor is our self-worth. How we perceive ourselves. The default here is to think of yourself as worthless. How to spend your time is a very difficult decision when depressed. What to do next seems an impossible decision to make because our decision-making apparatus doesn't work.
You could try doing something together, something that occupies your brain but doesn't actually matter. I find, playing Scrabble. Something that is completely trivial, but occupies your brain, but ultimately doesn't matter. Something that maybe it seems like a bit of a waste of time, but occupying somebody's brain when they're depressed, that isn't a waste of time. You're helping them just to get through the day, get through the depression bout. And it's very important to do that. Just to keep your mind occupied, keep distracted from the fact that you're depressed, and just keep going.
This inability to make decisions and think straight affects our ability to get things done. Normally, I like to make a to-do list and go through tasks one by one. When depressed, this ability to compartmentalize is compromised. It becomes impossible to see the tasks individually. Getting through your to-do list depends on your ability to break things down into individual steps. Now, when you're depressed, that ability to compartmentalize is faulty. So the example I always give is my houseplants. I counted the plants that I have in my house on one occasion, and there were 26. Now, normally I water them room by room, one by one. But when I'm depressed, I somehow can't see them as individual plants. Watering one of them means that I would have to water all of them, and that seems an insurmountable task. It isn't that I don't know that they're individual plants, but somehow I can't conceptualize them in that way. So it seems impossible to do. So instead of thinking, oh, I'll just water this one plant, I think, oh no, my plant's going to die, and there's nothing I can do about it.
The inability to compartmentalize and divide things into small steps affects every aspect of our lives. It becomes impossible to get even the smallest jobs done.
For now, let's close this to-do list and open the calendar.
Imagine if time wasn't divided into days, weeks, months, and years. It isn't that you don't know time is divided in this way, but somehow can't conceptualize it in your mind. It's just an endless stretch of now, and the now is depression. Depression for eternity, and it feels like there's only one way out.
Supporting someone with depression is extremely frustrating. And I think the depressed person knows that they are being annoying, they are being unresponsive, they will feel like they're letting you down. But it's so important to help the person through that. And they will value you for your support. However much it seems like they're ignoring you, however much they seem to be irritated by you trying to help them, they're not really. It is so important to have someone there, to know that someone cares about you. And however irritated you may be by them, and however they seem to be irritated by you, it's so important just to stay there and keep with it. And every winter that my husband stays with me, it just makes me love him even more.
What would you say to someone who thinks they might have depression?
First thing I would say is go see a doctor. It is scary thinking you have something like this, but it's also not that strange. A lot of people out there do have depression. It doesn't make you a freak. It is just a slightly different type of normal. I would strongly suggest you do talk to your family doctor or GP as soon as possible, as they can often prescribe low amounts of medication to help you. I completely understand that not everyone would want to take medication, but it is only a small effect, and if it works and you feel better, so please don't be afraid of it. Indeed, I take antidepressants myself. I would also strongly suggest that you talk to people, your friends, your family. We have come a long way as a society, and a lot of people are understanding of it now. Not everyone will be, and I fully accept that there will be some people you talk to who perhaps don't understand it, but there are also people who will, and there will also be people who have experienced exactly the same as you, because it is an annoyingly common thing to experience depression. So talk to your friends, talk to your family, and definitely don't be scared to seek medical help, because what you'll get initially will not be something major. It won't change who you are, but it just might make you feel better. And if it does, then why wouldn't you take it? If you broke your leg, you wouldn't not go to hospital because putting a cast on it or splint on it is giving in. You just wouldn't think that way. If you are ill, help is available. By all means, please just go for it. There is no reason not to. It's not giving in. It's not accepting something bad. It's there to help, and it does help. And I speak from personal experience there.
I don't know how non-Christians cope with depression. My faith is so important to me. Just knowing that God is always there to talk to, even when I feel distant from God, even when I can't feel his presence. It's me that's changed. God doesn't change. But I think there is a tendency within the Christian community to think of depression as a weakness of faith, that it's as a result of our personal sin, or that it's sinful itself, showing ingratitude to God. But there are so many examples of depression in the Bible. David was clearly depressed when he wrote some of the Psalms, and Elijah in the cave up the mountain. And Christ himself in the Garden of Gethsemane says, "My soul is overwhelmed with sorrow to the point of death." And on the cross, he says, my God, why have you forsaken me?" That's the ultimate cry of depression. And quoting from Psalm 22, where David was clearly depressed, he talks about himself as a worm and not a weed. So I think that if David can suffer from depression, and Elijah can suffer from depression, and Christ can suffer from depression, it can't be sinful. And I do believe in miracles. I believe that God can make blind people see, but there are plenty of blind people that God doesn't heal, just like there are depressed people that God doesn't heal. It doesn't mean that it's somehow our fault or a lack of faith. And I believe that God gave us medications to help us and other therapies. And I don't think that relying on them shows a weakness of faith, as long as we don't forget to rely on God as well. And so my recommendation to you, if you are feeling hopeless or anything else I've said in this video resonates with you, you are not alone. Help is available. You just have to ask for it.